Go. Hello, my name is Gabrielle Jones. I will be doing my indwelling catheter checkout for you today. Here's my ID. I will now ask my person to scan the room. I will be verifying my order. I will also say 3 causes of why I will be doing this skill. One will be to assist in healing of open sacral or perineal wounds and incontinent patients. Another would be acute ventilator-dependent respiratory failure, and another one would be acute worsening of mental status. I will also verify my hospital policy. I will also do hand hygiene, and I will do my 2 identifiers. Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963. I will also assess for his allergies, penicillin, penicillin. Mr. Jones, do you have any additional allergies? I will also now explain to him that I'll be doing your indwelling catheter today, and I will now gather my equipment. I will provide privacy, and I will move the trash can close to me, and I will wash my hands again. I will now make sure it's known that I have put my gown on. Gown and goggles is the uniform for this skill. I will now do hand hygiene. And for the bed, I will rise my bed up to my waist level. I will put my patient in dorsal recumbent position with his legs slightly bent. I will also lower the side rail. I will now verbalize that I will put on clean gloves, and I would do perineal care. For women, I would get one washcloth, clean one side, get another washcloth, clean the other, and get another washcloth and clean top to bottom. And for male, I will wash the meatus. I will get another one, wash the tip, and I will get another one to wash the rest of the skin or any foreskin that the male might have. I will now open my catheter kit. Make sure that I will open the flap that's away from me. The sides, making sure I stay in the 1-inch border. And I touched the side. I did not touch the sterile border. The sterile border. I will now don my sterile gloves. So way above my waist. Open my gloves. Get my right glove inside. I'll get my other glove. I will cuff it, making sure my thumb is upwards. And insert the other side. I have both gloves on. I will now fix my fingers. Making sure that my gloves are fine. The gloves are not on. I will now get my sterile fill out. Making sure you grab the side of the sterile border. This side, make sure I'm in the 1-inch border, like this. I will lay in, making sure there is no gaps in between the sterile border and my patient. Now move in the mirror, making sure I stay sterile. I will now make sure there's no gaps. I will put my sterile fill tray, making sure it's not touching my 1-inch border. I will now also say that I will pour Betadine on my cotton pads, and I will put lubricant in my tray. I will now clean my I will now remove my wrapper from my catheter, and I would get the syringe and put it in the port first. And I would get my catheter and remove the wrapper and place it in my trash can that is by the patient's hip. I would now have my catheter. I will now lube my catheter. Should stay sterile. 1 to 2 inches for females, and 5 to 7 inches for males, making sure it's lubed. I will now make sure I'll move my box closer to the patient. And I will now put this in the lube. I can now make sure that I clean my box for vagina. I get 1 cotton swab, clean one side, throw away my trash, grab another, this side, make sure I spread this, get another one, go down the middle, and throw this away. For male, I'll get the same cotton swabs. I'll do one around the meatus, I'll do another one around the tip, and I'll do another one around the skin or foreskin of the male penis. I will also now, be inserting the catheter. This hand now stays. I will spread, making sure the lips do not touch. I will now insert the catheter. I will tell my patient, if you bear down, then if you bear down, I will stick it in until urine returns, and I'll advance 1 to 2 inches more for females, or all the way for the bifurcation for the male. I will also tell my patient if I bear down if voiding, I'll take a deep breath or exhale with insertion. I will also say that I broke sterility. I touched the box with this hand. You not my finger touched the vagina. This hand stays touching the catheter because this hand is sterile and this hand is unsterile. I will now, the catheter is in. I will now hold the catheter with this hand, and then I will now inflate my balloon. I will make sure I'm applying pressure to the and I will now inflate my bubble, maintaining pressure. My bubble should now be inflated. I am now removing the syringe. Place my syringe here, and I can now tuck on the catheter to make sure that it is still stable. And I will now do my stat lock. I will get my stat lock. I would open it, put my tubing. This is me making sure it snaps. I can also unsnap it. And I would place my tab lock in the middle, on the inside of the thigh. Just like that. I would make sure I secured and unsecured. I will make sure that I would secure the drainage bag on the bed frame and below the bladder level. I'm sorry that this would be below the bladder level. And I would I will now, for easier, I will clamp this to the bedding, so it should stay, yeah. And so then I would did the stat lock. I will secure the drainage bag below the bladder on the bed frame. I will now collect urine from my port first. I would first unclamp it from the bed, and I will now clamp. And I would collect from the bed port. I would collect as much urine as I possibly could. Wait to the end. and I would making sure the tip does not touch inside the container, and I will pour urine in the cup. Sure it does not touch, and I can now tap back on, and I would label the urine cup with the patient's name thing. I can now unclamp and clamp back onto the bed, so it will stay. I will now move on to the bag. I will grab my urine cup. I will do it. Grab the urinary bag. I will unhook it. Make sure it is clamped first. I will do this over a bucket just in case any water spills. I will make sure that it will not touch the tip will not touch inside of the cup. I will now unclamp till urine fills the cup. And now I will clamp back again. Put my urinary cup right there. I will position bag right up there, making sure it's still clamped. I will put my top back on my urinary cup. I will label it with the patient's name, and that I would now did the first thing. I will now pour all the urine out of the bag. Into, make sure I dispose of the urine. I'll come back over here. This. And I will dispose of the rest of the urine. I will unclamp and dispose of the rest of it. Okay, I will clamp again. And I now will position it back. I now will clean up my material, and I will remove my gloves. I will remove clean up my material, and clean up my material. Now I remove up my gloves. First, glove to glove, skin to skin. I will now dispose of my glove above my waist. I will now lower the bed to the lowest point. I will raise the side rail, and I'll make sure my patient is comfortable. I'll make sure the call light is in reach of the patient, making sure everything that needs to be in reach of the patient is in reach. I will now do hand hygiene, and I will now verbalize that I will document the catheter size, the amount, the color, the consistency, the tolerance, the specimen collection. I would do daily catheter cleaning with soap and water. I would daily catheter cleaning with soap and water. I would do remove the catheter as soon as medically indicated due to the nurse-driven protocol. I will now discontinue with my catheter. I'll make sure I would have gloves on and my goggles on. I would do hand hygiene as well before putting my gloves on. I would make sure the bag is clamped, clamping of the bag, and I would empty out the I would take off the stat lock. I would now unclamp. I would now empty the drainage bag. I would measure the urine. I would unclamp. Just making sure. Hold on. I'm gonna say this would still be this. I would deflate the bubble, making sure the fate is debubbled. I would move the 10 milliliter syringe up and down to loose. I would pull the plunger back to 0.5. 0.5. I would insert into the port. So I would do this before the port. I would insert this into the port and it would empty by gravity. And then I would take out the catheter slowly and gently. There's that. I will also afterwards, I would document the amount, the color, the order, the consistency. I would document the catheter tip. I'll collect how much water was deflated from the bubble. I would remove the I would do the tolerance of the patient. I would now verbalize the symptoms of a UTI, which would be blood in the urine, the urge to use the bathroom to pee, and pain. And I will also say what the patient is voiding for 4 to 6 hours. The patients avoid 4 to 6 hours, and if not, to palpate the bladder, or we need to do a bladder scan. And that is the end of my, and I will also take off my goggles. I will take off my gown, and I will take off my gloves, and that is the end of my checkoff.